Hello, everyone. Welcome to SeniorOpedia, the everything how-to guide for seniors and caregivers. I'm Viraf Baliwalla, your host for this episode, and I've got with me Scott Johnson, who is the franchise owner for Home Instead Halton. Hi, Scott. Welcome to the show.
Yeah, thank you very much for having me. It's great to be able to have a conversation about this topic.
As we age, of course, everyone expects that we're going to have health issues and things like that. But there's not as much talk or consideration about what happens to the caregiver part of it. Yes, the seniors get the bulk of the attention there, but the caregivers also go through a heck of a lot, both mentally, physically, emotionally. And this is a great topic for us to talk about, is this sandwich generation and maybe how we can make life a little bit easier for them as well.
So you're absolutely correct. Our services that we offer really provide assistance for the senior in their home. But quite often, and more than that, we actually are a respite service for the adult children.
Respite means what?
We're basically giving them some relief. So being a primary caregiver, usually an adult daughter, to be honest, is very stressful. And it takes a lot out of your emotional being and your physical being. And what we find quite often is it takes its toll on you in terms of your health because you're spending so much time looking after a senior loved one. And this is where the sandwich generation term came to be, because generally it's an adult daughter looking after a senior parent, but they also have a family of their own with usually teenage children, which has its challenges itself, and trying to hold down a full-time job quite often. And really you're pulled from one end to the other, right? You're always on the go with either your parents or your children or your job. And it's very difficult.
When my in-laws first, my father-in-law passed away, and then some years later, my mother-in-law passed away. But in that meantime, my wife spent a lot of that time with responsibilities on all ends.
Yeah, what ends up happening is initially the parents, most of our senior clients, they want to stay in their own home as long as possible. That's where they develop their memories. That's where they raise their children. That's where they're most comfortable. So it usually doesn't take too much effort in order to help people stay in their home for as long as possible. But what ends up happening is the parents will ask one of their kids, usually a daughter, can you just give me a little bit of help, which amounts to maybe a couple of hours a week, help with some meals or laundry, something like that. But it slowly evolves, and eventually they're doing 20 to 30 hours a week looking after or providing services for their parent or parents. And it reaches a point where it's completely overwhelming for them. And this is where the sandwich generation comes in. We actually have this type of situation with office staff here. She has a teenage son who has some mental health challenges in school, and she just recently had her mom diagnosed with the beginning stages of dementia, hearing voices, and it's very disconcerting for her. So she's dealing with her mom as well. And although she has 4 sisters, she seems to be the primary one that gets the brunt of the responsibility of dealing with the mom and dealing with her son, and it's really overwhelming. So that support is what we do to help out those adult children deal with their situation a little bit better.
You mentioned mostly daughters and things like that, and I don't want to discount the fact that a lot of times sons are involved, but even when we're talking about our downsizing business where we're doing estate sales and online auctions for clients, we have usually found that the daughter or even daughter-in-law sometimes takes on a more of a project manager role than the men do.
Yes, correct. Yeah.
Of the family. It's not that we're excluding the men from the fact that they're not being as involved, but at the end of the day, the experience shows that it's usually the female.
Yeah.
The caregiver.
Over 20 years, and that's usually the case. It's usually the oldest female in the home that gets saddled with this responsibility, and it's not easy. So even though the services, as I said, are for client, the person that really gets the most out of it is really the adult daughter who's a primary caregiver, for sure.
And I think that in general, we all want to be strong, both for our parents as well as for everybody that's looking at us and, everything's fine. But it's not a bad thing because we know it's not fine. We know that you're going through so much and it's not easy to ask for help.
No, you're absolutely correct. And I think what the problem is, it started out with is minimal to begin with, but it evolves and escalates over time. And people are very reluctant to reach out for assistance. They feel their obligation their responsibility. It's their parent, so they don't want to shirk their responsibility. So they hesitate to reach out. But I can only tell people that reaching out to a home care company like Home Instead, it's going to allow you to become a daughter again, because you evolve into becoming a full-time caregiver. But you don't want to be a full-time caregiver. When you go to visit with mom and dad, you don't want to be doing the meals and the laundry and running around doing errands for them. You want to be able to sit and enjoy your time together, have a nice social visit, because quite frankly, you look back when your parents are gone, you look back on the times you spent with your parents, and you want to be able to look back on those times as meaningful, wonderful experiences,
right?
Not being a full-time caregiver.
And so with that, by having somebody there to help take care of I'll call it negative, for lack of better words. I know it's not negative. I don't want to imply that it is or should be, but you only have your positive experiences that are left if you have help to take care of the bathing and the cooking and the cleaning or whatever. So that way, like you said, when I come to visit, then I'm spending quality time with the parent.
I think that's the key. I think you nailed it, is the quality time. Because you can time with your adult parents, but if you're just doing tasks around the house, it's not quality time. So
right.
I think that's what you need to focus on. And quite frankly, we try to send in the same person on a regular basis. So we build that relationship with the client. It's not like the government services where someone different is going in every day.
There's continuity.
Exactly. And it's very important that we maintain the same people going in on a regular basis. So effectively, we become a surrogate daughter for that individual. And it gives the daughter a bit of a break and relieves her stress, because they deal with a lot. When you're working with teenagers and parents and a full-time job, it just becomes a little overwhelming, to the point where if she's married, the husband's going, where are you? I never see you anymore. You're just a visitor to our house. You don't actually live here. So it's important that we help people maintain their relationships by taking a lot of the workload off of them.
And that's what any sort of service that you hire is designed to do, take the workload off, so that either A, that's not your area of expertise, or B, it gives you your time back, because time is the one thing that we can never replace.
No, exactly. And we do, as well as taking some of the workload off the parents, because we're sending the same person on a regular basis and build that relationship, we become an outlet for the senior as well. Because quite often they don't want to complain about what's being done, even if it's not being done to the level of expertise they want by their child. They'll tend to not complain about it. But if a caregiver goes in, if it's not the right fit, we can get another caregiver in terms of personality fit. But also they have the opportunity to critique what's being done for them if it's not up to their standard, or they want to tweak the care plan a little bit. They're sometimes reluctant to tell their adult children that, because they feel they're doing it out of love for them and they're taking their free time. So I'm not going to complain about it. So in the situation where you have professional caregivers going in, we can tweak the service and critique the service that's being done to their liking.
Do you find that there's a lot of seniors complaining, being ornery, or anything of that nature when you have your staff go in?
I find that the caregivers that are going in are a bit of an outlet for the seniors. So they can talk to them about things that they may not normally talk to their adult children about. Usually they're not complaining about the service of the people going in, although we have had to replace people with personalities that usually they're complaining about their state of life. They've gotten older, they can't do the things they used to do. There's a bit of an outlet for them to talk to somebody about that, as opposed to their adult kids that don't want to burden them with these problems. So they'll talk to somebody who's considered a professional more easily. Let's put it that way.
More than a professional, I guess once you started to see them repeatedly, they become your friend.
Exactly. Yeah, it's a very fine line, because we want to build that relationship, but you don't want to cross the line where you're getting too personal a relationship. So it's a very fine line that the caregivers have to walk in order to be a confidant and an assistant for them, but they don't want to become a family member, so to speak, right? That can be a problem.
Right.
Well,
would you classify your workers as PSWs, personal support workers?
we have a combination of PSWs and caregivers. And the caregivers, we have about 230 people on staff, and I'd say half of them are PSWs.
Okay.
PSWs have a different perspective when they go into a home. They're very task-based, so they have to do these tasks for the individual. And they do tend to help build those relationships, but the caregivers that build the best relationships are the ladies that we have on staff that are 45 and up. So they connect with the seniors better. They understand more what they're going through because they're closer in age. And I find they're more caring and compassionate to build those types of relationships.
Okay, interesting enough. PSW technically is person who is more, as you said, task-based. They're there to do the cooking and the cleaning, the bathing, whatever it may be.
Yes, correct.
And a caregiver, in your definition there, is that a PSW plus?
No, they're not usually PSWs. We do have training for them. The PSW program is usually a 2-year college program, and they teach people how to provide assistance with transfers and personal care, bathing, assistance in the washroom. They tend to be best for situations where someone is bedridden or has a serious debilitating health issue because they're trained to do those sort of things better. But if the client is more or less in good health, still fairly mobile, I tend to find the caregivers are a better fit. And because some of the services we offer are meal prep, the caregivers kind of work better in the meal prep kitchen area than the PSWs. They're usually younger ladies who really don't have the expertise in terms of culinary skills.
Okay, that's interesting to know. With regards to male versus female, is it primarily females that you would have going in this sort of role, or are there males as well?
No, we probably only have about 5% of our caregiving staff are male. Quite often, the male clients will want a male. If they're still active, have a couple of clients that caregiver would go with them to the driving range and hit golf balls, just an example. Right? But probably most of the time, male and female clients are okay with females providing services.
All right. Now, when somebody brings you on, how does that process typically happen? Do they have a breakdown and finally realize, okay, we want to bring somebody into health?
Usually what we find is some sort of a traumatic crisis that takes place. Like mom may have a fall in the bathroom and fracture a hip and she ends up in the hospital. And the hospital workers will want to discharge her, but her mobility still isn't great. And families try to do the best they can. But again, they're not trained to help with transitions and mobility issues. So they'll basically Google and they'll call us and we set up a care consultation. I'm the owner of the company, but I still do the care consultations myself. I really enjoy that part of the job, meeting people and meeting families and being a solution to their problems. That's what I love about this job in this industry. So I sit down with a family. It's a very informal kitchen table kind of discussion. And we talk about the challenges that their senior parents have and how we can be a solution. We put together a care plan for them. But we also have a QA person in the office who reaches out on a regular basis to family members and to the clients to make sure that the caregiver is a good fit, the care plan is still representative of what they're looking for, and if there are any changes to their health or their mobility, we can evolve the care plan to something a bit more robust, and we can change the care plan with them, how they change, how their health is changing, how their independence is changing. So we can change with them and meet all their needs as they move through.
But sometimes parents can live on to quite a late age.
Oh yeah, absolutely. But what we find is they don't want to necessarily go to a retirement home. Although having said that, sometimes it's a necessity, right? Especially where there's cognitive challenges and there may be wandering taking place, somebody giving stages of dementia. So in those cases, a facility is probably a better fit for them. Half of our clients are actually in facilities, believe it or not. When we started this, I assumed all of the services we offer would be in private homes, but it's not. Sometimes we're in facilities as well, helping people with getting out of the facility, taking enjoyable drives to go down to the Burlington Gardens, Botanical Gardens, or just go out for a cup of coffee and get out of the facility. So we do a lot of services in the facilities as well.
There really is a companionship issue or solution as well as caregiving.
That is huge, actually, in terms of this one of the services that we offer. We noticed that especially during COVID, when family members couldn't go and visit their senior parents, and the social interaction wasn't there for the seniors. So having a professional caregiver go in made a huge difference to their mental health.
Interesting. And so with regards to the process of somebody going through it, there's a traumatic issue, as you say, they start doing their research, they find different places that they can reach out to see who can provide help. Are there government programs for that as well? So really, are you competing with the government programs?
I don't think so. There are government programs out there that assist people. So when you get discharged from the hospital, they may set up PSW to come into your home 2 or 3 times a week for bathing purposes, but they're not there to socially interact or develop those relationships because it could be a different person depending on who they decide to send in. But having said that, I think what we do definitely supplements the support that the government services give. Right? We operate in different facets of services that the government doesn't do. So I think it's a good working relationship we have a client and work together because we can get feedback from each other, kind of know what's going on in the home. And if there's something that somebody sees, we can inform the government services as to what we're seeing, and then they can adjust their services as well down the road.
We just had a close family member who had a stroke, and they were released from the hospital. They've got PSWs coming in 3 times a day, in fact, to assist with the different task functions, right? But the family is just doing an amazing job at caring for that person outside of the times when the PSW is there.
Yeah.
And helping them exercise, helping them move, and things like that. Is that a candidate for sort of thing as well?
It is, because of the adult kids, if they're available, it's great, but quite often they're not. So sometimes they're not available to take a leave of absence from their job or take time off to help their parents. So we can essentially fill in for them if they don't have that luxury.
And would they hire you for X number of hours at a time, or how does that work?
We work on an hourly basis in terms of what we charge, and we work on a minimum of a 3-hour shift. But we can work anywhere from 3 hours up to 24 hours a day. And it doesn't have to be permanent. So as an example, quite often we'll provide 24-hour care for someone when they first come home from a hospital stay. We just want to make sure they have their sea legs and they're feeling confident in the house, especially back and forth to the washroom in the middle of the night. That's a recipe for disaster.
Would you have different shift workers for that, or the person lives at home? Or?
We have 12-hour shifts. So we have a 12-hour day and 12-hour night shift. And we're just there for maybe even a week just to make sure things are going smoothly, that the transition to the washroom isn't unsteady, that they're comfortable and confident in being by themselves. And then we can pair it back to maybe even 3 hours through the day, maybe to help with meals, picking up prescriptions at the drugstore, picking up groceries, things like that.
So these sort of services aren't locking you in for months or years at a time.
No.
It's just you basically customize it to whatever the needs are.
Yeah, we're very flexible in the way we do things. So really, in order to change the schedule or cancel service, all we need is 48 hours notice. And we understand in emergency situations where someone's rushed to the hospital, we don't require 48 hours notice. But we're very flexible in the way we set up the schedule, and we can transition the schedule from a large number of hours to a minimal number of hours within 48 hours. It's not a problem.
And as far as the cost structure of this sort of program, how does that work?
It varies depending on the number of hours that you have as coming in per week, type of services that you're requiring in terms of the skill set of the person coming in.
Because you had mentioned it was hourly, but...
Yes. Essentially, we have a minimum number of hours per week, which is 9. So most people will go with a Monday, Wednesday, Friday schedule for 3 hours. That's generally what people look for. So that way, they still have some independence through the week, and then they have their weekends free when family members will come over. But in the meantime, the family members have eyes and ears through us to see what's going on in the household.
That's an important part too, because it's not just what they do in the home with the senior that counts.
Right.
It's a matter of, okay, you got to report back so that family members know that things are moving along in the right direction. Because sometimes the parent may or may not share.
So that's essentially what our client services advisor does in the office here. She'll meet with family members and the clients and just go over the care plan and make sure things are going well. So even something as simple as the caregiver noticing that the food in the fridge is spoiled and the senior doesn't throw it out and eat spoiled food down the road, right? Even something as simple as that can save a hospital visit.
I know that when we've gone in to help with the downsizing portion for many clients, we have to clear out everything, including the food.
Yeah.
And oh my gosh.
Yeah, it's growing
Inside the jar, but nobody's dealt with it.
Seniors will do that. They'll say, I don't want to throw this out. I'm sure it's probably fine. Let's keep it.
It'll be fine.
Exactly. It'll be fine. No, it's not fine. The other thing we can do too, when I go in and do the care consultation, as well as talking about a care plan, we can review the household. So we can have a look at situations that, as an example, in a shower or a bathtub, there's no bars there to help people transition in and out of a tub. They don't have a shower chair to be sitting on, which they should have when they're getting in and out of a tub and when they're doing their bathing. just having somebody there to help them in and out of the tub, but they sit on the shower chair. They can look after their own bathing, but they just need the assistance getting in and out of the tub. But having these props around to help them in their day-to-day activities is a huge help.
And you said usually within 48 hours or so, you can find somebody that...
Yes, correct.
Once they start engaging you, then very quickly you can have somebody in place.
Yeah, exactly. But the other thing we can do, what we've done in the past, we don't do all the time, but some of the families will ask to meet the caregiver ahead of time. So we'll do what we call a meet and greet. So we'll send in a caregiver or a PSW based on the skill set and the care plan to go ahead and meet the client and the family members. And if there's no cost to them, they just have a kind of a informal conversation and conversation about what they're looking for, and they get to understand or meet the caregiver or the PSW and see if that personality is a good fit.
Is it like an interview process?
Almost, yeah. They go in and makes them feel better and more confident about having someone come into the house. Because when you got someone coming out of the house for the first time, never been there before, they're not used to home care, it feels almost invasive, right? But having someone go in ahead of time, they're not being charged for the hour or two that the caregiver is there, but it allows them to feel more comfortable with the individual and feel more comfortable with the services that are coming into the home.
Excellent. That's very enlightening. It sounds like it's a very valuable service out there, both for the senior as well as for the caregiver. And I am sure that many people are going to appreciate having a bit of distance and time from the routine of having to, or from the task of having to do some of these functions.
Yeah, absolutely. No, it tends to be a big relief. I don't know how many times, as I said, I've been doing this 20 years, and I don't know how many times I'll hear from an adult child, I don't know what the heck we did before you guys came into the picture here, because my life was a complete mess and it was a disaster. It's pulling my hair out. I wasn't sleeping, and now I feel some peace now that you guys are there, being a surrogate child for my parents.
That said, how can somebody get a hold of you if they have more questions or information?
They can Google Home Instead Halton, or our phone number is 905-847-8433. We operate in Milton, Burlington, and Oakville. But having said that, if they're not in that area, we have 52 offices across Canada, and I can certainly introduce the individual to an office that's in their parents' geographical area.
Excellent. Scott, thank you very much for joining us and sharing what you guys do. It's a very valuable service. I think that for the caregivers, like I said, my wife's done it, I've done it. And yeah, it can be quite draining if you don't ask for help.
Thank you for having me on. It's been a great experience. I really appreciate it.
Take care.
Thanks, Barry.
Like this episode? Then subscribe, like, share, and most importantly, register for upcoming notifications at SeniorOpedia.com.